Respiratory therapy, Lesson 9, heated humidifier. This unit covers the basics of respiratory therapy. The goal for this lesson is to understand the necessity of heating and humidification during mechanical ventilation, and to learn about proper heat and humidity settings. Understand proper heating and humidification settings. This is the content of this lesson. The gas sent from the ventilator is dry and the temperature is not adjusted, therefore, the gas needs to be heated and humidified for patients on ventilators either by using a heated humidifier or an artificial nose. Otherwise, the dry gas would be delivered directly to the lungs because the upper airway is bypassed by the tracheal tube and cannot play the role of heating and humidifying the air. The dry gas can cause harm to the lungs, such as decreased ciliary movement, the airway mucosal injury, and solidification of mucus. First, we will discuss the physiological temperature and humidity in the airway. As shown in the figure, under physiological spontaneous breathing, both inhaled and exhaled air reach a temperature of 37 degrees Celsius, absolute humidity of 44 mg per liter, and relative humidity of 100% at the time they reach the lungs. The important factors here are absolute humidity and relative humidity. Absolute humidity is the absolute amount of water contained in a given volume, and it is an indication for the quantity of how much water is contained per liter. Relative humidity, on the other hand, is the ratio of moisture in the air to the amount of saturated water vapor, indicated as a percentage. The humidity data we see in our daily life for weather, etc. is a relative humidity. Also, the higher the temperature, the more moisture the saturated water vapor can contain. Therefore, even if the absolute humidity is the same, the relative humidity is lower when the temperature is higher. The optimal condition of the air in the human body is a temperature of 37 degrees Celsius with absolute humidity of 44 mg per liter and relative humidity of 100% at the point of reaching the lungs. In order to obtain the optimal condition of the air at the point of reaching the lungs, the temperature of 40 degrees Celsius with relative humidity of 85% at the point of Y-piece is the optimal setting considering the drop in temperature in the tracheal tube. Also, the relative humidity is 100% when condensation is visible in the tube, therefore, if the temperature of the Y-piece is 40 C and the condensate water is visible in the respiratory circuit, you can consider that heating and humidification of the air reaching the lungs is sufficient. Please note that there are differences in individual patients and the heated humidifier should be set in consideration of firmness of the mucus and the external environment such as the room. This is the end of Lesson 9, Heated Humidifier. Make sure you've mastered the basic concepts before you move on to the next level.